Why is combination chemotherapy strategic for lymphoma? Imagine fighting a battle where the enemy can change its tactics to avoid being defeated. That's similar to how lymphoma cells can resist treatment. Using only one drug might not be enough because cancer cells can adapt and survive. That's why doctors often choose combination chemotherapy for lymphoma. It involves giving multiple drugs at the same time, each with a different way of attacking the cancer. This approach makes it harder for the lymphoma cells to escape destruction. Different chemotherapy drugs interfere with cancer cell growth and division in unique ways. When combined, they attack the lymphoma cells from multiple angles, increasing the chances of killing more malignant cells. This is especially important because lymphoma can be a very diverse disease, with different subtypes responding differently to treatment. Combining drugs allows doctors to tailor therapy to target specific lymphoma types more effectively. Another key reason for using combination chemotherapy is to prevent or delay drug resistance. Cancer cells can sometimes become resistant to a single drug, making treatment less effective over time. But when multiple drugs with different mechanisms are used together, it's much less likely that the cancer will develop resistance to all of them at once. This helps improve the chances of achieving long-term remission. Clinical studies have shown that combination chemotherapy often leads to better outcomes than using just one drug. For example, regimens like ABVD, which includes adriamycin, bleomycin, vinblastine, and dacarbazine, are standard for Hodgkin lymphoma because they have proven to increase cure rates and prolong survival. For non-Hodgkin lymphoma, multi-drug protocols are also used to improve response rates and reduce the risk of relapse. Doctors also consider the specific characteristics of each patient and their disease when designing treatment. Some combination regimens are chosen to target particular lymphoma subtypes or molecular features, especially in aggressive or resistant cases. This personalized approach helps maximize effectiveness while managing side effects. Speaking of side effects, using multiple drugs at carefully balanced doses allows clinicians to achieve strong anti-lymphoma effects without causing excessive harm. They often deliver chemotherapy in cycles, giving normal cells time to recover between treatments. This approach helps reduce long-term risks like infertility or secondary cancers, while still fighting the disease effectively. In summary, combining chemotherapy drugs is a strategic choice because it increases the likelihood of killing more cancer cells, prevents resistance, and improves survival chances. It also allows for treatment customization based on the specific lymphoma type and patient health. This approach has transformed lymphoma from a disease once considered very difficult to treat into one where many patients can achieve remission or even cure. Always remember, treatment plans are personalized, so it's essential to discuss options with a healthcare professional to find the best approach for each individual.